My name is Bygbjerg, and I'm Professor of International Health, not of Global Health, but I'm running a Global Health Master's course. Why don't we call it International Health? And since I'm still a Professor of International Health, I have also asked myself that question. Is it really necessary with changing to global health? And a lot of pros and cons can be said about that. It's the remaining inequity in health that, as one of my colleagues just told, who returned from Ethiopia, where he saw the patient-doctor ratio, which was incredible, 1 doctor per 40,000. In this country, it's 1 per 400. The other one is the one-eyed look at health, which is very often disease. It's disease-focused. We know that there's a lot to gain if you prevent and promote health. And then, of course, there's the big clash between diseases or health problems, if you like, where we are either looking at infectious diseases and undernutrition, or on non-communicable diseases and overnutrition, and forget to link them. And that's very, very dangerous. Infectious diseases, which are still killing a lot of children in developing countries and so on, and old people. And then we've got the non-communicable diseases that are going up like that. And then we've got the clash between the two. And the whole world is geared, not least developing countries, the World Health Organization, do something to tuberculosis. It's a curable disease and so on. But nobody is interested in doing anything to diabetes. It's your own pocket, it's your lifestyle. You're a sinner. You're either too fat, you're drinking too much, smoking too much. And then my counter question is, how comes that half of the world's population with so-called type 2 diabetes, which is the most prevalent, are not fat, are not drinking, and are not smoking cigarettes? Is it their lifestyle, or is it something else? Accidents, including traffic accidents, workplace accidents, because nobody is really taking on them. Which international drug company would promote something on motorbike accidents? If we are not looking after those who are going to bring the society forward next time, then we have a big problem. And nobody is interested in traffic accidents, with very few exceptions. Yeah. Of course, you will have to have something which is trying to include everything. I'm only afraid that in the present way, global does not necessarily mean including all the aspects of health and disease. It's very much originating from the north, and then we hope we can get some, but how many global health schools are there in the south? Very few. And if we don't have the global south, and east as well as west, together with the north and west, what is global?